All right, everyone, let's talk now about another structure or another approach which you can use with dealing with medical errors here. So you may have lots of cases in BLAP 2 exam or in INOSCO exam that there is a medical error has happened. For example, the patient was treated for infection based on a wrong X-ray, or the patient was given a wrong antibiotic, or the blood sample of the patient was missed or was, for example, not labeled. So this is all are medical errors which can happen in clinical practice, how to deal with a patient in this particular case. So data gathering, you should follow the same style as we did in the counseling structure. You can check the counseling structure in the mind maps package anyway, but let's do how we deal with the error itself. So the medical error, you start by checking understanding or paraphrasing. You would have a task telling you the story. The patient was admitted maybe 2 days ago with heart attack, and maybe that was missed in the first time. He came before and he was, for example, dismissed or was told he has a musculoskeletal pain or whatever. So there is a medical error happened. Or for example, the patient had a blood sample and it wasn't labeled. So the lab didn't proceed with the sample and the lab actually destroyed it because it wasn't labeled. So you need to talk to the patient. Check his understanding first. Mr. Jack, can you tell me what has happened with you? I do understand you have been admitted for the last 3 days. Can you talk to me through what has happened, or what do you know? How much do you know about the medical problem you are having or the treatment you are receiving? Yeah. So you check understanding to check the story. You can bring that by paraphrasing what you have in your task. So what you have in your task is a story. You can bring it back in the start of the station by paraphrasing it and telling the patient to tell you more about that, or to check what does he know about that, or he can talk to you through about what has happened here. So have professional curiosity. You need to spend 1 or 2 minutes in this step by having more curiosity to know from the patient and to understand the story the same way you understand it or he understands it. Yeah. And then the second step, as we did before in the counseling structure, we check for the well-being of the patient today. We check if there is any harm or any symptoms he has because of the error. So that can include any harm because of the error. For example, if the patient was given a wrong antibiotic, you would ask for any symptoms like any rash. How are you doing today, Mr. Jack? I feel fine, doctor. So have you been feeling any side effects at all, like any nausea, any vomiting, any rash? So you do explore any harm. Yeah. And you can actually check the symptoms of the medical problem he had in the beginning. For example, if he is coming or he has come because of a chest infection, you would ask about symptoms of a chest infection. So do you still have any cough? Yes, doctor, do you bring any sputum? What color is that? Do you have any chest pain, any problem with breathing? So in this particular step, you ask closed specific questions for 2 things here. Any harm, okay, from the error, and symptoms of the medical problem itself. Okay, that will be very easy in most cases here. And then after you do that, you can go ahead to break the news here. So you almost finished your data gathering by that time. Yeah. If it's a very short station and you are worried that you finish very early in time, I would strongly suggest in this particular step of taking history or exploring symptoms or harm questions, you can add 1 or 2 questions about psychosocial and the relevant maftosa. For example, if the patient does smoke, in case of infection, and psychosocial, how that problem has been affecting him. Has it been stopping him from going to work? If yes, so what does he do for living? You can take 1 or 2 or 3 good questions here to fulfill your station. Yeah. And then the third step in every medical error is breaking the news. You need to tell the patient about the error. What you need to know about this step, you should always be honest and be direct. Do not make things beautiful. Say it as direct, as honest as it is. And you need to know that you never judge, you never blame, you never defend anybody. If the patient, for example, if there is a medical error, do not try to cover for anyone, do not try to blame anyone, do not try to defend anyone. It's not your responsibility. This should be investigated, and then we can know whose mistake is that or what we should do for next to avoid that from happening again. So if the patient is telling you, doctor, is it the mistake of your colleague? Is it the junior doctor who missed the heart attack, or who missed the x-ray, or missed the right antibiotic? I'm really sorry, Mr. Jack. I do not have that answer yet, because things should be investigated thoroughly so we can understand what went wrong and how we can avoid that from happening. Yeah. Something like that. So you break the error here and you make sure you give it in honest and direct language. Yeah. And then the patient will be angry, will be upset, indeed will be best because there is a medical error happened in his medical care. So what you do after that, let him or give him some time to vent, give him some time to express his emotions, and you follow that by apologizing or giving sympathy and empathy. So apologizing is very healthy. Do not make it as a big deal. You are apologizing because the patient had to go through a hard experience with the medical team. So I'm very sorry you had to go through that. That will be very nice to say. Okay, and give sympathy and empathy as well. I can see it must be difficult. Anyone in your situation would feel the same. So apologize and give sympathy and empathy. Then you complete your error structure by managing or summarizing or planning ahead. Think how you can fix that error. So management here will be 4 steps. First thing is rectifying the error or correcting the error. For example, if the patient had a missed blood sample, so you arrange another one for him. So Mr. Jack, what do you think? Would you mind if we arrange another blood sample for you? Yes, doctor, or no, doctor, then you can address that. Okay, or we'll rebook that appointment for you, or we'll redo that test for you. You correct the error, whatever the error was. Okay, the second thing or the second thing in your management will be raising that medical error with your team or with your seniors. Mr. Jack, we take such incidents very seriously. I'll raise that with the team so we can discuss it and we can find why this mistake has happened and how we can avoid that from happening again. The third step in your management is reporting the incident. If there is a medical error happened, for example, wrong antibiotic or missed, for example, biopsy sample or any medical error happened, you can write an incident form, which we call DATEX. So that can be investigated by the hospital authority so they can find what went wrong and they can actually implement actions how to avoid these mistakes from happening again. So what will happen, doctor, for example? You may tell the patient, depending on the error, Mr. Jack, or depending on the investigation results, maybe that can include recruiting more staff in some cases, maybe changing the IT or updating the IT system, or maybe doing more training, depending on the error. But you can just say, we'll report that incident so it can be investigated and looked at seriously and with plan of action as well. The last thing, if the patient is asking you that he would like to complain, so please guide him for that. Okay, so doctor, I would like to complain. I would like to take that further. Yes, Mr. Jack, that's indeed, you're right. You have every right to do that. I'll bring for you a leaflet about our complaint department. You can talk to them and you can raise your complaint, indeed. And then you finish your history or you finish your station by safety net the patient about any red flags. You can arrange a follow-up if this problem needs a follow-up. Okay, some people are confused because they say we need to offer complaint in every single medical error, which is not right. You do not encourage people to do complaints against your workplace. This is not the usual practice. No one would love you for that. But if the patient asking to complain, you should and you must help him to do that. Okay, but if you can solve the problem for the patient locally and you can talk to your team, you can fill the incident form, that should be enough if he is not very keen to complain. Yeah. The last thing or the overall, you should be gentle, you should be sympathetic, and you never blame or defend anybody. You do not blame or you do not put blames on anybody. This is not your job. You are not the one who is investigating him. And always think how to rectify, how to plan ahead with the patient, how to correct the error for him, and how to raise that concern so we learn from it and we avoid that from happening again. Yeah. So this is how to deal with any medical error stations. I hope you found it useful. If you like to join our mind maps package, which is a package includes all cases, more than 400 cases in mind maps, each case in a single mind map, and each mind map in 5-10 minutes maximum, which covers everything in data gathering and the management based on the guidelines. Yeah. And it has a lot of other playlists as well, as you can see in the image. Feel free to contact me on that WhatsApp number if you are keen to join. Otherwise, please join my groups from the description of the video so you can always attend our free sessions. And I hope you all the best and you deserve 12 out of 12. Thank you.